Hi everyone, welcome back to another video, and today is going to be a little bit different because I wanted to touch on something that I'm sure a lot of you have questions on, and this is just a big point of misunderstanding when we're talking about differences in sexual development. So today's topic is, do intersex children need medical or surgical intervention? And this is kind of a complicated issue, but I can give you a pretty simple answer for most cases, and that answer is no. Most of the time, you do not need to medically or surgically correct somebody with a difference in sexual development. For example, if somebody has ambiguous genitalia, it is not necessary for you to surgically assign them to a biological sex. Of course, that's something that you're going to want to talk to the parents and the child about as the child grows up. It used to be that they would have a committee of people, usually doctors, and then the parents would be part of this decision making, and they would assign the child to one of the two sexes, and then they would operate. But that's no longer standard procedure. Nowadays, we have learned that we can take time and let the child grow up and figure out if they want to be assigned to a binary sex or if they are okay with their body as it is. And that is a personal decision for that child to make. And I actually am in favor of this. I think there's no need cosmetically for someone to be forced into a category that they may not want to fit into. And I don't think that we should be using procedures like that on somebody who is not ready to make that kind of decision. Obviously, somebody who is a baby or a toddler is not going to be able to understand what it would mean for them to get surgery like that. And so that's no longer commonplace. We don't just use these surgeries cosmetically until the child is ready. That being said, there are certain conditions which we talked about in videos, especially those pertaining to the adrenal gland, that do need medical intervention. For example, congenital adrenal hyperplasia. So all three of those deficiencies we talked about with 21 hydroxylase, 11 beta hydroxylase, and 17 alpha hydroxylase, those all cause problems with adrenal function. If you remember, we had issues with aldosterone. So we had blood pressure issues. We had dehydration issues. We also had problems with cortisol. And those are important things that we would medically need to intervene about. But we're not going to step in and change their genitalia. What we're going to do in that case is we're going to supplement them with mineral corticoids. So we're going to make sure that they have an appropriate level of aldosterone. We're going to make sure that they have glucocorticoids. So we're going to probably give them a steroid to stimulate a typical level of cortisol. And that's going to help them on an endocrine level maintain necessary body functions to be alive. So yeah, that is something that we would undergo without necessarily having the child's consent, because that is a life-saving procedure. Other things that we might do, for example, if somebody has ambiguous genitalia and they have something that we call hypospadias or epispadias, this is where the urethra opening is either on top of the penis or underneath the penis. And that is something that we might actually surgically intervene about, because that can increase risk of UTIs, and it can be very dangerous. So that's a case as well where we would fix the underlying life-threatening issue, but we're not using a treatment necessarily to assign them to a biological sex. So I hope that this video was helpful, and I hope you kind of understand now more clearly about where our medical thought process is going. If you have any comments or debates, if you think that we should be assigning people to a biological sex at a young age, leave your comments down below. I'd be happy to have that discussion with you. But please ask any questions you have, like this video, subscribe to my channel, and I will see you all in the next one.